Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. What to do when your baby cries. Introduction. At times, babies cry for no reason, but more often than not, crying is a baby's attempt to communicate. When your baby is crying, your baby is trying to tell you something. It is your job as a parent to find out why your baby is crying. Knowing why your baby is crying will help you know what to do. This program will help you understand what to do when your baby cries. It covers why babies cry, what to do, and when to seek medical advice. It also includes a section about how to take care of yourself when raising an infant. Causes. There are many reasons why babies cry. Most often, babies cry because they need something. Babies may cry because they are hungry, wet, or tired. They may also cry because they need to be burped. Babies may also cry because they feel lonely or uncomfortable. Crying could mean that a baby wants to be bundled up or maybe wants to suck on something. Babies cry if they don't feel well. Sometimes crying can be a sign of a medical problem. Also, babies may just be fussy and cry for no obvious reason. Over time, parents usually begin to understand their baby's needs. Babies may cry in a different way if they are hungry or wet. Noticing patterns can help you better care for your baby. What to do? The first thing you should do when your baby cries is determine why he or she is crying. If you know why your baby is crying, it is easier to care for him or her. Watch your baby for signs of hunger. Babies eat every few hours and may start crying when it gets close to their feeding time. Babies may show hunger by crying, fidgeting or squirming, licking their lips, making a smacking sound. Babies may also show hunger by moving their head frantically from side to side, opening and closing their mouth, positioning self for nursing, sucking on their fingers, toes, clothing, or toys. If babies eat too fast, they may swallow air during the feeding. This may cause more crying due to gas pains. You should always take time to burp your baby during and after feeding. This helps your baby get rid of any air swallowed. When burping your baby, gently rub or pat the baby's back. You may find it easier to burp your baby using one of the following positions. While standing or sitting, hold your baby's chest against your chest with his or her head resting on your shoulder. Sit your baby up on your knee or on your lap. Support the baby's head by holding the chin and resting the palm of your hand against the baby's chest. Lay your baby down on your lap, on his or her chest. Support your baby's head and keep it higher than his or her body. Be patient and gentle when burping your baby. There's no single right way to do it. Choose a position that is both convenient and comfortable. You will learn what works best for your baby over time. Your baby may begin crying if his or her diaper is wet or soiled. Check your baby's diaper often. Babies need a lot of sleep. If your baby is not sleeping enough, he or she may get fussy and start crying. Try a pacifier to help soothe a crying baby. Sucking is a normal reaction for babies. Sometimes babies cry because they want to suck on something. Babies may also cry if they are not comfortable. Babies can cry because they are too hot or too cold. Remove or add a layer of clothing if this is the case. Some babies may also cry because they want to be swaddled. You should snugly wrap your baby in a blanket to make him or her feel safe. There are many different ways to swaddle your baby. The best way to learn how to swaddle a baby is by talking to or observing the nurses that work in the newborn nursery. Some babies may respond best to having their hands and feet bundled when they are swaddled, while other babies may prefer to have their hands kept free. Making your baby happy again may be as simple as moving him or her. Some babies may cry because they want to be rocked or put in a new position. You could also try putting your baby in a stroller and going for a walk. Babies also cry if there is too much noise or movement. If this is the case, move your baby to a quiet room. In some cases, white noise may help your baby relax. Babies can even cry when they want to see or hear you. If your baby is lonely, cuddling your baby or lightly patting your baby's back may help stop his or her crying. Some babies cry at certain times of the day. This uses up extra energy your baby may have. All you can do when this happens is comfort your baby until he or she stops. If you can't figure out why your baby is crying, you may simply try letting your baby cry. This can be difficult, but sometimes babies need to cry in order to fall asleep. If your baby can't be comforted and is otherwise healthy, he or she may have colic. Colic is when your baby cries more than 3 hours each day, 3 days a week, for more than 3 weeks. Colic usually begins suddenly a few weeks after birth. It can continue until your baby is 3 months old. Talk to a healthcare provider if you think your baby has colic. A healthcare provider can rule out other causes of crying and suggest some treatment options. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. When to see a healthcare provider. Sometimes crying may be your baby's way of telling you that something is wrong. Watch to see if your baby is eating, sleeping, and acting normally. Also, check your baby's temperature. Contact your healthcare provider if your baby has a rectal temperature of 100.4 degrees Fahrenheit or higher. If you are concerned about your baby's crying, you should talk to a healthcare provider. A healthcare provider will be able to tell you if your baby's crying is normal or if there is another reason. Take care of yourself. Trying to understand your baby's crying can be frustrating. Remember to relax. Staying relaxed makes it easier to soothe your baby. Don't take your baby's crying personally. Some babies cry for no obvious reason. This does not mean you are a bad parent. It is normal for babies to cry 1 to 4 hours each day. Make sure you get plenty of rest. Not resting enough can cause you to become frustrated faster. If you start to become frustrated, get help from your spouse, partner, another family member, or a friend. A short break from the crying may help you calm down. It is important to remember to be gentle with your baby no matter how frustrated you become. Never shake your baby. This can lead to blindness, brain damage, or even death. Also remind yourself that this crying stage is temporary. Babies cry the most for 6 to 8 weeks after birth. Their crying slowly decreases after 8 weeks. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. At times, babies cry for no reason, but more often than not, crying is a baby's attempt to communicate. When your baby is crying, your baby is trying to tell you something. It is normal for babies to cry 1 to 4 hours each day. When your baby is crying, your baby may be trying to tell you something. There are many different reasons why babies cry. Knowing why your baby is crying will help you know what to do. Sometimes crying may be your baby's way of telling you that something is wrong. If you are concerned about your baby's crying, you should talk to your healthcare provider. The first thing you should do when your baby cries is determine why he or she is crying. If you know why your baby is crying, it is easier to care for him or her. Trying to understand your baby's crying can be frustrating. Remember to relax. Staying relaxed makes it easier to soothe your baby. Remind yourself that this crying stage is temporary. Taking care of yourself is the first step in caring for your baby. Thank you for using Explain.